Hello nurse, welcome back to my channel. Today we are discussing about the things a nurse should know. What is a skilled nurse and what skills are required to be a nurse? Skilled nurses are those that have covered all the necessary training to excel in the chosen areas of practice. Nursing skills often make a life or death difference for patients. A good nurse should have core medical and clinical knowledge to work confidently in your chosen field. Patient care knowledge and techniques. Because patient care lies at the very heart of the nursing profession, the knowledge and techniques needed to deliver that care are exceedingly important. This means that nurses must have a firm command of nursing fundamentals such as patient assessment, vital sign measurement, care planning, and treatment assistance. They must also possess a firm understanding of medical terminology and legal and ethical standards. Urgent and emergency care. Even if you don't necessarily plan to become an ER nurse, you have to build some urgent and emergency care skills to support your practice. Nurses may encounter emergency medical circumstances, so you should be ready. For this reason, nurses are wise to learn at least basic urgent care fundamentals. Taking patient and family history. A crucial element of the patient assessment process, gathering and recording patient and family history gives the healthcare team a solid foundation on which to start viable diagnosis and treatment options. In addition to asking patient about any current symptoms, nurses need to gather information about past conditions and important issues such as allergies and pharmaceutical reactions. Beyond patient's history, nurses must often take family medical histories to better diagnose hereditary conditions. Patient's mobility. Helping patients with mobility issues is an integral part of many nursing positions. This might mean lifting patient in and out of bed, supporting them as they sit down or stand up, wheeling them in a wheelchair or hospital bed, or assisting them as they walk. They may also need to instruct and train patients to use mobility equipment. Performing CPR and BLS. Cardiopulmonary resuscitation is an essential skill for all nurses. When a person's heart stops beating, performing CPR as quickly as possible can double or triple that person's chance of survival. All nurses must also have knowledge on basic life support to respond immediately to assist people who are experiencing a severe medical emergency. Medication management. Nurses can't prescribe medications, but they can aid physicians in the prescription process. When the proper prescription have been filled, nurses play a crucial role in the administration of medication and the oversight of patient's medication plan as they monitor patient care. Nurses often collaborate with physicians and other team members to change the treatment. Patient safety and infection control. The patient safety concerns of nurses extend far beyond the specific facilities in which they work. Nurses must provide detailed instruction and do all that they can do to prevent falls, avoid medication issues, and generally ensure the safety of the patients both while they are under direct care and after they depart the facility. Effective infection control measures not only prevent the health of the patient but also the health of the healthcare staff and the general public as well. IV placements and infusions. In short, for intravenous, the term IV is often used to refer to the needle, catheter, or tubing system that delivers intravenous fluid into patient's bloodstream. Nurses often tasked with placing IVs. Effective communication. Effective communication is a basic skill every nurse should have. Nurses constantly communicate with patients and their family members, and nurses of all kinds must learn to communicate effectively with all medical teams that they support, often in high pressure and high sensitive situations. Critical thinking. The tough scenarios in which nurses often find themselves require effective critical thinking, in addition to communication skills. Critical thinking in the nursing profession involves accurately analyzing patient situations and making the best possible decisions based on that analysis. From onboarding new patient to identifying a new condition and symptoms, it is important for nurses to assess information and solve problems quickly. Physical endurance. Nurses often work long hour shifts and may have regular opportunities or requests for overtime. So nurses should prepare to work long hours on your feet. Particularly strenuous tasks such as lifting patients in and out of bed and providing physical support during movement only add to the physical demand that many nurses endure during workday. Empathy for family members. A valuable quality among nurses, empathy is the ability to see things from someone else's point of view. Because nurses often work with patients struggling with troubling health concerns and empathetic than other. Empathy is also a learned skill and it's never too late to acquire it. Especially you can learn how to listen more carefully, validate the feelings of others and employ effective conflict resolution strategies. Interpersonal skills. Building empathy can greatly enhance your interpersonal skills, also known as social skills. Interpersonal skills help you to interact with people in a friendly, affirmative, and productive manner. They can aid in your all workplace relationships as a nurse. With individuals who range from patient to supervisors, specific nursing interpersonal skills to emphasize include patience, cooperation, motivation, flexibility, dependability, and leadership. Teamwork management. Because nurses generally function as part of a large medical team, teamwork is paramount to success in the field. If you grow into nursing leadership positions, over time you will need to promote optimal teamwork by managing elements such as rapport and self-respect building, problem solving, conflict resolution, listening and persuasion. High attention to detail. Because the health and well-being of their patients are so important and because they are tasked with a broad range of often complex tasks, they must complete in a timely manner. Nurses must be detail-oriented to succeed. They must exercise extreme precision to ensure that patients receive the right therapeutic treatments, including the right dosage of the right medication at right time. They must also be able to assess changes patient symptoms in detail and document. Organization and time management. Good organization can help you manage your time, while effective time management can help you better organize your day. Nurses tend to handle multiple tasks and patients at once. Prioritizing and planning day tasks from medication administration to equipment setup is extremely important. High adaptability, flexibility. Although planning is a key element of nursing, nurses must also have the flexibility to adapt to changing circumstances. Each day is different for most nurses, and nurses often have to roll with the punches and cope with the constant stream of last minute changes in areas that include shift scheduling, patient conditions, treatment alterations, and assigned responsibility. Ethics and professionalism. People may argue the finer points of ethics. Most of us can generally agree on the basis difference between right and wrong. Essentially, nurses should approach their workplace responsibilities with a great amount of discipline and strive to treat everyone in the workplace with absolute respect. In terms of delivering ethical and professional care, nurses must endure to preserve patients' dignity and remember their pledge to do no harm. I hope you learned few things from this video. Please subscribe to our channel, like and share this video to your friends. And you can also follow us on Instagram, NurseWorld25. Thanks for watching.